this module, we will talk about women in the labor force with a focus on reproductive hazards. So given that over 70% of women in the U.S. labor force are women of reproductive age, reproductive effects are one of the major concerns among working women. But first, let's define what we mean by reproductive health and reproductive hazards. The World Health Organization defines a reproductive hazard as a state of complete physical, mental, and social well-being, and not merely the absence of disease, in all matters relating to the reproductive system and to its functions and processes. A reproductive hazard refers to substances, environments, or activities that may increase the risk of adversely impacting reproductive health or the ability to have healthy reproductive outcomes. Now, there are many different measures of birth and pregnancy outcomes, as shown here, that could be linked to workplace exposures and are used as measures of reproductive health. For example, preterm birth, low birth weight, infant mortality, and spontaneous fetal losses. Large epidemiologic studies have been conducted to assess the role of employment and specific job occupations or workplace exposures on reproductive health outcomes. For example, a large population-based European birth cohort study, which consisted of 13 birth cohorts with over 200,000 mother-child pairs, assessed whether maternal employment during pregnancy overall and in select occupational sectors was associated with different birth outcomes. Researchers found that pregnant mothers who were employed had a lower risk of preterm delivery than those who were not employed, and that select occupations were associated with decreased or increased risk of adverse birth outcomes. For example, employment in the food industry versus other jobs was linked with an increased risk of preterm birth. In another study, known as a National Birth Defects Surveillance Study, which is one of the largest studies on birth defects ever undertaken in the United States, researchers sought to examine the associations between a spectrum of 24 maternal occupations and 45 birth defects among cases with birth defects versus controls. It was found that pregnant women who were exposed to polycyclic aromatic hydrocarbons, or PAHs, were more likely to have babies with cleft lip with or without a cleft palate. PAHs are chemicals that are formed during the burning of coal, oil, gas, and garbage, or from smoking cigarettes, cigars, or pipes, or from charbroiling meat. In addition, it was reported that several occupational groups were positively associated with one or more birth defects, including janitors and cleaners, who had a 43% increased odds of having a baby born with one or more birth defects. So while any worker, male or female, planning to conceive can be vulnerable to reproductive workplace hazards, women workers may be exposed during more critical windows of vulnerability, including the preconception, prenatal, and postnatal period. It is also important to consider that workers who have pregnant or breastfeeding partners or workers who are pregnant or nursing themselves must also be protected from potential hazards due to the take-home exposure pathway. The take-home exposure pathway is when workers take chemicals home on their work clothes, their skin, their hair, or even their shoes, as chemicals may harm the fetus, infants, and toddlers. For example, it has been shown that farm workers may bring pesticides home on their clothing, their shoes, and even vehicles, and could be a source of exposure for other household members, including spouses and young children at home. It is also recognized that large disparities continue to exist in many reproductive health outcomes, with women of color being the most impacted. It is reported that Black women are more overrepresented than any other demographic group in healthcare and are heavily concentrated in some of its lowest wage and most hazardous jobs, placing them at an increased risk of adverse reproductive effects. So there are many ways in which workplace hazards can impact reproductive health. This could be from interrupting normal hormone processes, including the menstrual cycle and sex hormone imbalance. For example, high levels of physical or emotional stress or exposure to chemicals, such as carbon disulfide, may disrupt the balance between the brain, pituitary, and ovaries. This disruption can result in an imbalance of estrogen and progesterone and lead to changes in the menstrual cycle length and regularity as well as ovulation. Because these sex hormones have effects throughout a woman's body, severe or long-lasting hormone imbalances may affect a woman's overall health. Workplace hazards may also damage eggs in women, as well as sperm production in men, They can also disrupt the function of reproductive organs as well as hinder normal pregnancy and fetal or child development, which could lead to adverse birth outcomes, such as birth defects, and impact child development. Lastly, workplace hazards, such as chemicals, can also alter the composition of human milk, thereby increasing the risk of transferring potentially harmful chemicals to the nursing infant. Some of the workplace hazards that could impact reproductive health include physical injury, physical agents, such as radiation, noise, and heat, as well as stress and workplace organization, infections, and chemical exposures. Physical injury, for example, could result from falling or being struck by an object or machinery at the workplace during the prenatal period. There is also moderate evidence that repetitive heavy lifting could also increase the risk of preterm birth and miscarriage. So some examples of physical agents that could impact reproductive health include radiation, noise, and excessive heat or extreme temperatures. In the case of radiation, it is recognized that exposure to ionizing radiation at the workplace could increase a woman's chances of having reproductive problems, such as having a baby with birth defects. Ionizing radiation can also cause chemical changes in cells and damage DNA. Radiation to the ovaries themselves can destroy eggs, disrupt egg production, and diminish egg quality, as well as increase the risk of infertility and carrying a baby to full term, in addition to exposing the fetus. For example, a pregnant woman who accidentally swallows or breathes in radioactive materials may absorb that substance into her bloodstream. From the mother's blood, radioactive materials may pass through the umbilical cord to the baby or concentrate in areas of the mother's body near the womb, exposing the fetus to radiation. Prenatal exposure has also been linked to increased risk of childhood cancer. The risk of severe health effects from radiation at the workplace will depend on the gestational age of the fetus at the time of exposure, as well as the amount of radiation that it is exposed to. Another workplace hazard that can impact reproductive health is loud noise. For example, hearing loss in the fetus may occur if the mother is exposed to noise frequencies greater than 110 decibels, and there is also suggestive evidence that loud noise may also increase the risk of pregnancy-related hypertensive disorders and diabetes in full-time workers, as well as increase the risk of low birth weight. Heat is another physical agent that may impact reproductive health. Overexposure to heat has been linked to infertility in males as well as adverse birth outcomes, including birth defects, preterm birth, and stillbirth. For workplace stress and organization, women in particular face a unique set of challenges at work due to issues like childcare and interpersonal relationships. Moreover, it is reported that women in the U.S. are spending more hours working than ever before, leaving less time for personal obligations, with some of these jobs characterized by little to no control and autonomy, and shift work, which may add additional stress. Meanwhile, women still have to shoulder a large caretaking burden, which impacts mental health. In addition to the recognized chronic risks of occupational stress, including heart disease, occupational stress can also impact fertility. It is recognized that women hold more low-wage jobs than men, and occupational stress, in conjunction with low income and life stressors, may increase the risk of adverse pregnancy outcomes, such as preterm birth. In the U.S., it is estimated that there are about 13 million women holding low-wage jobs. Other factors that may increase stress include short maternity leave. In the United States, it is estimated that about 25% of women return to work within 2 weeks of giving birth. Another reproductive workplace hazard includes infections. Infections could also increase the risk of adverse reproductive health outcomes. This includes the rubella virus, toxoplasmosis, parvovirus, COVID-19, as well as Zika for workers who travel to endemic areas, and many others. In fact, emerging evidence suggests that pregnancy is associated with a higher risk of severe COVID-19 infection compared with the non-pregnant population, including higher risk of pneumonia, admission to the intensive care unit or ICU, and increased mortality risk even after adjusting for potential risk factors for severe outcomes. And while the evidence with regards to preterm birth and perinatal mortality is conflicting, some studies do suggest that these risks are higher only in symptomatic hospitalized women. Here, we can see different infectious agents that women may come into contact with at the workplace and their potential reproductive health risks. A common workplace where exposure to these infectious agents can occur includes healthcare settings and those working with animals, including in research facilities. An example is exposure to HIV or rubella, which is also known as German measles, among healthcare workers, which are both associated with an increased risk of having a baby that is low birth weight. Chemical workplace hazards may also impact reproductive health, especially since a lot of the chemicals that women may be exposed to include endocrine disrupting compounds. These are substances that can alter or mimic hormone function in the body. For example, it has been reported that chemical exposures can reduce fertility in women when exposed to cancer treatment drugs like antineoplastic drugs, as well as when exposed to lead. Chemicals may also disrupt the menstrual cycle and/or sex hormone production, and some of the chemicals that have been linked to these outcomes include pesticides, organic solvents and degreasers like toluene, xylene, trichloroethylene or TCE, and polychlorinated biphenyls or PCBs. Additionally, chemical workplace exposures may impact children's health if exposed during critical windows of development, including the prenatal and postnatal periods, as mentioned previously. Here are some examples of substances observed to induce adverse reproductive outcomes following exposure during pregnancy by occupation. For example, prenatal exposure to pesticides among agricultural workers has been linked with adverse effects on offspring, including adverse neurodevelopment. This slide provides examples of specific chemicals, many of which are recognized or suspected endocrine disrupting compounds that have been linked to several fertility-related effects. For example, phthalates have been associated with menstrual and ovulatory irregularities, miscarriage or fetal loss, as well as reduced fertility. Here are some examples of potential reproductive toxicants by occupations for your reference. For example, hairdressers and cosmetologists may be exposed to different solvents, formaldehyde, which is a carcinogen, phthalates, dyes, as well as other potential reproductive toxicants. While research is ongoing, chemicals have been measured in human milk and may be transferred to the infant. Metals like lead, mercury, cadmium, and other heavy metals have been found in human milk. Other chemicals found in human milk include organic solvents and volatile organic chemicals, as well as some radioactive chemicals used in hospitals for radiation therapy like iodine-131. However, it's important to highlight that human milk does still provide benefits for the infant. It has been shown that human milk can decrease the risk of infection, allergy, asthma, and other chronic conditions, so it's important to support workers who are nursing when possible unless otherwise noted by health professionals. Now, there are several factors that can influence toxicity of reproductive hazards. The first one is timing and duration of exposure. Exposures to reproductive toxicants may occur during several periods, including the preconception and prenatal period, as well as a postnatal period, such as when the mother is nursing. The impact of exposures to reproductive hazards depends on when they occur in relation to windows of vulnerability and development. For example, harmful exposures during the first trimester have the greatest likelihood of causing major birth defects. This is because many important developmental changes take place during this time. Different organs and systems are developing during pregnancy and even after pregnancy. For instance, a child's brain and respiratory system continue developing after birth, so exposures during the postnatal period are still of concern and importance. So as we can see, occupational exposures among women workers may impact not only women, but also children's health. Other factors that may influence toxicity of reproductive hazards include the extent of exposure or dose, which refers to the amount of the chemical that is absorbed in the body and how much reaches the fetus, as well as a route of exposure, that is, how the chemical enters the body. Inhalation happens to be the most common way that chemicals can enter the body. Some chemicals, like ammonia, are potent respiratory irritants. Since these chemicals react with the first tissue they contact, very little enters the bloodstream. Therefore, they're unlikely to affect other parts of the body, including the reproductive system or a developing fetus. Other chemicals, however, are absorbed through the lungs into the bloodstream and are able to reach the reproductive organs or the developing fetus and may cause harm. Other routes of exposure include dermal absorption, whereby some chemicals can be absorbed through the skin and enter the bloodstream. If the skin is cut or cracked, or if a skin rash is present, chemicals can penetrate the skin more easily. Ingestion is another route of exposure to chemicals at the workplace. This happens to be the least common route of exposure. Lastly, characteristics of the parents may also influence toxicity of reproductive hazards or increase the risk of adverse effects. For example, recognized genetic diseases or deficiencies in the family or the individual could increase the risk of adverse health effects to the fetus. Another thing to consider when we're talking about reproductive health and reproductive hazards is that although most employees are able to safely perform their jobs throughout pregnancy, pregnancy can sometimes affect worker safety in several ways. Changes in pregnancy can increase the rate that women absorb some chemicals, for example, some metals. As she grows, a pregnant worker may find that personal protective equipment, or PPE, such as lab coats or some types of respirators, may no longer fit correctly. Changes in a pregnant woman's immune system, lung capacity, and even ligaments can alter her risk for injury or illness due to some workplace hazards. Workplace exposures can also affect the health of a pregnancy. Some chemical exposures might be riskier for a fetus than its mother due to its rapid development and smaller relative size. For most chemicals, we don't have good information on what levels of exposure might harm a fetus. Occupational exposure limits are also intended to protect workers and cannot necessarily be applied to a fetus. So it's important to note that while occupational standards and guidelines are used as a measure of safety at the workplace, compliance with these may not adequately protect women's reproductive health. As in most cases, industrial exposure limits promulgated for most chemical agents by the U.S. Occupational Safety and Health Administration, such as their permissible exposure limits, or OSHA PELs, or those from the American Conference of Governmental Industrial Hygienists, threshold limit values, also known as ACGIH TLVs, have in most cases been established without considering protection from adverse reproductive or developmental health effects. This means that they do not adequately protect women during the preconception or prenatal period or the developing fetus.